Question 1. Regulatory review indicates that registered dental assistants are expected to educate patients on the fundamental structure of teeth to promote understanding of oral health. When explaining the different dental tissues to a patient concerned about tooth sensitivity, which of the following approaches best aligns with regulatory expectations for patient education and professional practice? Option A. Describe enamel as the hard, protective outer layer, dentin as the layer beneath that contains microscopic tubules making it sensitive, the pulp as the vital inner core containing nerves and blood vessels, and cementum as the tissue covering the tooth root, emphasizing how damage to these layers can lead to sensitivity or other issues. Option B. Explain that the pulp is the part that feels pain, and that if it's damaged, the tooth will fall out, causing significant distress. Option C. Focus primarily on the enamel's role in chewing and ignore the deeper structures, as they are not visible. Option D. Briefly mention that teeth have a hard outer shell and a soft inside, and that sensitivity means the inside is exposed. Correct answer is A. Describe enamel as the hard, protective outer layer, dentin as the layer beneath that contains microscopic tubules making it sensitive, the pulp as the vital inner core containing nerves and blood vessels, and cementum as the tissue covering the tooth root, emphasizing how damage to these layers can lead to sensitivity or other issues. Explanation. Scenario analysis. This scenario presents a professional challenge because a registered dental assistant, RDA, is tasked with identifying and explaining the structural integrity and sensitivity of different dental tissues to a patient. Misinformation or incomplete understanding can lead to patient anxiety, distrust, and potentially improper home care practices. The RDA must accurately convey complex biological information in an understandable manner, adhering to established professional standards and patient education protocols. The challenge lies in translating scientific knowledge about enamel, dentin, pulp, and cementum into practical patient advice while remaining within the scope of practice for an RDA. Correct approach analysis. The correct approach involves accurately describing the protective outer layer enamel, the underlying sensitive layer dentin, the vital inner core pulp, and the root covering cementum. This approach demonstrates a thorough understanding of dental anatomy and histology, which is fundamental for an RDA. By explaining the relative hardness and sensitivity of each tissue, the RDA empowers the patient with knowledge about why certain dental conditions occur, e.g., sensitivity due to dentin exposure, and the importance of protecting these structures. This aligns with the ethical obligation to provide accurate patient education and promotes informed consent and patient engagement in their oral health. Regulatory frameworks for RDAs typically emphasize the importance of patient education and the need for accurate information dissemination regarding oral health. Incorrect approaches analysis. An approach that oversimplifies the tissues by only mentioning hard outer layer and sensitive inner part fails to provide sufficient detail and may not adequately address patient concerns. This lacks the specificity required for effective patient education and could lead to misunderstandings about the causes of dental issues. It may also fall short of the expected standard of care for patient instruction. Another incorrect approach might be to focus solely on the visible crown of the tooth and neglect the root structures like cementum, which are crucial for tooth support and can be affected by periodontal disease. This incomplete explanation would not provide a holistic understanding of the tooth's anatomy and its vulnerabilities. A third incorrect approach could involve discussing the pulp's sensitivity in a way that causes undue alarm or fear, without balancing it with information about protective measures or treatment options. This would be a failure in patient communication and could violate ethical guidelines regarding patient well-being and minimizing unnecessary anxiety. Regulatory guidelines often stress the importance of clear, reassuring, and accurate communication. Professional reasoning. Professionals should approach patient education by first assessing the patient's current understanding and then tailoring the explanation to their level of comprehension. This involves using clear, non-technical language where possible, but also providing accurate scientific information when necessary. The decision-making process should prioritize patient understanding, comfort, and empowerment. RDAs should consult their specific state or jurisdictional practice acts and board regulations to ensure their patient education activities are within their authorized scope of practice. When in doubt, consulting with a supervising dentist is always the appropriate course of action. Question 2. The risk matrix shows a potential for patient dissatisfaction if radiographic procedures are not performed as requested, yet also highlights the ethical imperative to avoid unnecessary radiation exposure. A patient, who has not had a dental exam in several years, insists on having a full set of dental x-rays taken immediately, stating they just want to be sure everything is okay. The registered dental assistant, RDA, is aware that a full set of x-rays is not typically indicated for a routine screening without specific clinical signs or symptoms. What is the most appropriate course of action for the RDA? Option A. Perform the full set of x-rays as requested by the patient to ensure patient satisfaction and avoid potential complaints. Option B. Politely refuse to take the x-rays, stating that it is against policy to perform them without a specific directive from the dentist. Option C. Explain to the patient the diagnostic benefits of the requested x-rays, the principles of radiation safety, ALARA, and the importance of clinical indication for radiographic procedures, while also consulting with the supervising dentist to determine the necessity based on the patient's history and current oral condition. Option D. Proceed with taking the x-rays without further discussion, as the patient is an adult and has the right to request any dental procedure. The correct answer is C. Explain to the patient the diagnostic benefits of the requested x-rays, the principles of radiation safety, ALARA, and the importance of clinical indication for radiographic procedures, while also consulting with the supervising dentist to determine the necessity based on the patient's history and current oral condition. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a patient's expressed desire and the registered dental assistant's, RDA, professional and legal obligations regarding radiation safety and informed consent. The RDA must balance patient autonomy with the ethical and legal imperative to protect the patient from unnecessary radiation exposure, adhering to established ALARA, as low as reasonably achievable, principles and state-specific radiography regulations. Correct approach analysis. The correct approach prioritizes patient safety and adherence to regulatory standards for radiation exposure. This involves educating the patient about the necessity and risks of the radiographic procedure, explaining the benefits of obtaining the diagnostic images, and clearly communicating the legal and ethical limitations on performing procedures without proper justification. This approach upholds the RDA's duty of care, aligns with the principles of informed consent, ensuring the patient understands the procedure and alternatives, and complies with state dental board regulations governing radiography, which mandate that x-rays are taken only when clinically indicated. Incorrect approach is analysis. Performing the x-rays without justification, despite the patient's request, would violate the ALARA principle and potentially expose the patient to unnecessary radiation, which is a direct contravention of state radiography regulations and ethical dental practice. This approach disregards the professional judgment required to determine clinical necessity, refusing to explain the procedure or the rationale for taking x-rays, and simply stating its policy, fails to uphold the principle of informed consent and can erode patient trust. While adhering to policy is important, the RDA has a responsibility to communicate the reasoning behind those policies, especially when they relate to patient health and safety. This approach neglects the communication aspect of patient care and ethical practice, immediately dismissing the patient's request without any attempt at education or explanation demonstrates a lack of professional engagement and disrespect for patient autonomy. Even if the request is ultimately not fulfilled, it fails to address the patient's underlying concerns or provide them with the necessary information to make an informed decision about their oral health. This approach is ethically deficient as it bypasses the opportunity for patient education and collaborative decision-making within the bounds of professional practice. Professional reasoning. When faced with a patient request that may conflict with professional obligations, an RDA should engage in a process of patient education and clinical justification. This involves 1. Understanding the patient's request and underlying concerns. 2. Reviewing the patient's clinical history and current condition to determine the necessity of the radiographic procedure. 3. Clearly explaining the diagnostic benefits of the x-rays, the risks associated with radiation exposure, even minimal, and the ALARA principle. 4. Articulating the legal and ethical requirements that guide radiographic procedures. 5. Collaborating with the supervising dentist if there is any ambiguity or if the patient remains insistent on a procedure deemed unnecessary. The ultimate goal is to ensure patient safety, provide appropriate care, and maintain ethical and legal compliance. Question 3. The performance metrics show a consistent increase in patient complaints regarding gum sensitivity and bleeding during routine dental hygiene appointments over the past quarter. During a recent examination, you observe mild erythema and edema in the gingival margins of several patients, along with some localized bleeding upon gentle probing. What is the most appropriate course of action for a registered dental assistant in this situation? Option A. Advise patients to increase the frequency of their brushing and to use a firmer toothbrush to address the perceived plaque buildup. Option B. Document the observed gingival inflammation and bleeding and communicate these findings to the supervising dentist for further assessment and diagnosis. Option C. Suggest patients purchase a specific brand of over-the-counter mouthwash known for its anti-inflammatory properties to alleviate symptoms. Option D. Record the observations in the patient chart, but defer discussing them with the dentist until the next scheduled team meeting. The correct answer is B. Document the observed gingival inflammation and bleeding, and communicate these findings to the supervising dentist for further assessment and diagnosis. Explanation. The performance metrics show a concerning trend in patient-reported outcomes related to gingival inflammation and bleeding during routine dental hygiene appointments. This scenario is professionally challenging because it requires the registered dental assistant, RDA, to move beyond simply performing tasks and engage in critical observation, patient education, and appropriate intervention within their scope of practice. The RDA must interpret subtle clinical signs, understand the underlying periodontal health, and communicate effectively with the patient and supervising dentist. The correct approach represents best professional practice because it prioritizes patient well-being and adherence to established clinical protocols. By recognizing the signs of potential periodontal disease, the RDA demonstrates a commitment to early detection and intervention, which is crucial for preventing more severe conditions. Documenting findings accurately and communicating them to the supervising dentist ensures a collaborative approach to patient care, aligning with the ethical obligation to provide competent and comprehensive services. This approach also reflects an understanding of the RDA's role in patient education, empowering individuals to maintain their oral health. An incorrect approach that involves dismissing the patient's complaints and attributing the symptoms solely to aggressive brushing fails to acknowledge the potential for underlying periodontal issues. This oversight constitutes a failure to adhere to the standard of care, as it neglects to investigate further when signs of inflammation are present. Ethically, it breaches the duty to provide diligent care and can lead to delayed diagnosis and treatment, potentially worsening the patient's condition. Another incorrect approach, which involves recommending over-the-counter anti-inflammatory medications without a dentist's prescription or diagnosis, exceeds the RDA's scope of practice. This action constitutes practicing dentistry without a license and poses a significant risk to the patient, as it bypasses the necessary diagnostic process and could mask symptoms of a more serious condition. It violates regulations governing the practice of dental auxiliaries and demonstrates a lack of professional judgment. A third incorrect approach, which involves documenting the findings but failing to communicate them to the supervising dentist, creates a communication breakdown and compromises patient care. While documentation is important, it is only one part of the process. The dentist needs this information to make an informed diagnosis and treatment plan. This failure to communicate can lead to missed opportunities for timely intervention and can be considered a lapse in professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and assess the patient's signs and symptoms, considering both objective findings and subjective reports. 2. Consult relevant clinical knowledge regarding periodontal health and disease. 3. Determine if the findings fall within the RDA's scope of practice for assessment and reporting. 4. Document all findings accurately and thoroughly. 5. Communicate critical findings and concerns to the supervising dentist promptly. 6. Provide patient education within the RDA's scope of practice, focusing on preventive measures and reinforcing the dentist's recommendations. Question 4. Implementation of a new sterilization protocol for dental instruments has been completed, and during the initial use of the sterilized instruments, a dental assistant experiences a needle stick injury from a contaminated instrument. What is the most appropriate immediate course of action for the dental assistant? Option A. Immediately wash the affected area with soap and water. Report the incident to the supervising dentist or designated safety officer and seek prompt medical evaluation as per the office's exposure control plan. Option B. Assume the risk is minimal because the instruments were just sterilized and therefore do not report the incident. Option C. Disinfect the affected area with an antiseptic wipe and continue with the scheduled patient appointments. Option D. Wait to see if any symptoms of illness develop over the next few days before reporting the incident to avoid unnecessary concern. Correct answer is A. Immediately wash the affected area with soap and water, report the incident to the supervising dentist or designated safety officer, and seek prompt medical evaluation as per the office's exposure control plan. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in dental assisting: managing potential exposure to bloodborne pathogens during a procedure. The professional challenge lies in balancing efficient patient care with the paramount responsibility of ensuring the safety of both the patient and the dental assistant. A lapse in judgment or adherence to protocols can have serious health consequences. Correct approach analysis. The correct approach prioritizes immediate and appropriate post-exposure management as mandated by regulatory frameworks such as the Occupational Safety and Health Administration (OSHA), Bloodborne Pathogen Standard, 29 CFR 1910-1030. This standard requires employers to establish and implement a written exposure control plan, which includes procedures for post-exposure evaluation and follow-up. Promptly reporting the incident, seeking medical evaluation, and adhering to the healthcare provider's recommendations are crucial steps to mitigate the risk of infection and ensure the dental assistant's health. This aligns with the ethical obligation to self-care and the professional duty to follow established safety protocols. Incorrect approaches analysis. One incorrect approach involves delaying reporting the incident to assess if symptoms develop. This is a significant regulatory and ethical failure. OSHA mandates prompt reporting and evaluation, not a wait-and-see approach. Delaying can compromise the effectiveness of post-exposure prophylaxis, PEP, if indicated, and it violates the employer's responsibility to provide a safe working environment and manage occupational health risks proactively. Ethically, it demonstrates a disregard for personal health and the established safety procedures designed to protect the dental team. Another incorrect approach is to dismiss the incident as minor and not report it, assuming no significant risk. This is a critical failure to adhere to the exposure control plan and regulatory requirements. Even seemingly minor exposures can transmit serious pathogens. This approach neglects the principle of universal precautions, which assumes all blood and body fluids are potentially infectious. It also undermines the employer's ability to track incidents, identify trends, and improve safety measures, which is a key component of OSHA compliance. A third incorrect approach is to rely on personal knowledge of the patient's health status to forego reporting. This is a dangerous assumption and a violation of regulatory guidelines. The bloodborne pathogen standard does not permit exceptions based on perceived patient health. Confidentiality laws also protect patient health information, and dental assistants should not be privy to or make decisions based on such information in this context. The focus must remain on the potential for exposure and the established protocol for managing it, regardless of the patient's known health status. Professional reasoning. When faced with a potential bloodborne pathogen exposure, a dental assistant should follow a structured decision-making process. First, immediately cease the procedure if safe to do so and address any immediate bleeding or contamination. Second, report the incident to the designated supervisor or employer representative as per the office's exposure control plan. Third, seek prompt medical evaluation from a qualified healthcare provider, bringing any relevant information about the exposure. Fourth, cooperate fully with the medical evaluation and follow all recommended post-exposure prophylaxis and follow-up protocols. This systematic approach ensures compliance with regulations, protects personal health, and upholds professional responsibility. Question 5. Quality control measures reveal that during a routine intraoral examination, a registered dental assistant observed a small, asymptomatic, slightly raised, white, velvety patch on the lateral border of the tongue of a patient. The RDA also noted a small, well-defined erythematous area with a slightly irregular border on the buccal mucosa. Which of the following actions best reflects the appropriate professional response for the registered dental assistant. Option A. Only document the erythematous area as it appears more concerning and ignore the white patch as it is asymptomatic. Option B. Advise the patient that the white patch is likely leukoplakia and the red area is probably an irritation, suggesting they rinse with warm salt water. Option C. Document both findings in the patient's chart with detailed descriptions of their appearance, size, and location, and then promptly report these observations to the supervising dentist for further evaluation. Option D. Inform the patient that these findings are normal variations and no further action is needed. The correct answer is C. Document both findings in the patient's chart with detailed descriptions of their appearance, size, and location, and then promptly report these observations to the supervising dentist for further evaluation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the registered dental assistant, RDA, to move beyond simply performing tasks and engage in critical observation and interpretation of patient findings. The challenge lies in distinguishing between common, benign variations and potential indicators of underlying pathology that necessitate further professional evaluation. This requires a solid understanding of normal anatomical variations versus signs of disease, and the ability to communicate these observations accurately and efficiently to the supervising dentist. The professional responsibility extends to patient safety, ensuring that no potentially serious condition is overlooked. Correct approach analysis. The correct approach involves meticulously documenting all observed findings, both those that appear normal and those that deviate from the expected. This documentation should be objective, detailed, and include specific observations about the color, texture, size, and location of any abnormalities. Crucially, the RDA must then communicate these findings clearly and promptly to the supervising dentist, providing them with the necessary information to make a diagnosis and treatment plan. This aligns with the ethical and regulatory obligations of an RDA to assist in patient care, maintain accurate records, and act within the scope of practice, which includes recognizing and reporting deviations from normal. The emphasis is on accurate observation, thorough documentation, and effective communication with the dentist. Incorrect approach is analysis. One incorrect approach is to dismiss any finding that appears minor or unfamiliar without further investigation or reporting. This is a significant regulatory and ethical failure because it can lead to the delayed diagnosis of serious conditions, potentially harming the patient. RDAs are expected to have a foundational understanding of oral anatomy and common pathologies, and any deviation from the norm, regardless of perceived severity, warrants attention. Another incorrect approach is to attempt to diagnose the condition or recommend treatment. This directly violates the scope of practice for an RDA, which is to assist the dentist, not to diagnose or prescribe. Such an action would be a serious ethical and regulatory breach, potentially leading to patient harm and disciplinary action. A third incorrect approach is to only document findings that are clearly abnormal and significant, ignoring subtle variations or findings that are not immediately understood. This creates an incomplete patient record and fails to provide the dentist with a comprehensive picture of the patient's oral health, which is essential for proper care and legal documentation. Professional reasoning. When faced with patient findings, a professional RDA should follow a systematic process. 1. Observe carefully and thoroughly. 2. Compare observations against knowledge of normal anatomy and common variations. 3. Document all findings objectively and precisely. 4. If any finding deviates from the norm or is of concern, communicate it immediately and clearly to the supervising dentist, providing all relevant details. 5. Trust the dentist's expertise for diagnosis and treatment planning. This process ensures patient safety, maintains accurate records, and upholds the professional and regulatory standards of the RDA role. Question 6. System analysis indicates that during a routine dental radiographic procedure, a registered dental assistant, RDA, observes an unusual flickering of the X-ray unit's indicator light and a subtle, inconsistent hum that was not present during previous exposures. The RDA suspects a potential issue with the equipment's radiation output or shielding. What is the most appropriate immediate course of action for the RDA to ensure radiation safety and protection? Option A. Immediately stop the radiographic procedure, inform the supervising dentist and the facility's radiation safety officer, or equivalent, and await further instructions or assessment of the equipment. Option B. Briefly pause the procedure to visually inspect the X-ray unit for obvious external damage. Then resume the procedure if no immediate damage is apparent. Option C. Continue the radiographic procedure, but attempt to adjust the exposure time and milliamperage settings to compensate for any perceived inconsistencies in radiation output. Option D. Proceed with the radiographic procedure as planned, assuming the observed anomalies are minor and unlikely to pose a significant radiation risk to the patient or operator. The correct answer is A. Immediately stop the radiographic procedure, inform the supervising dentist and the facility's radiation safety officer or equivalent, and await further instructions or assessment of the equipment. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a registered dental assistant, RDA, to balance the necessity of diagnostic imaging for patient care with the paramount importance of radiation safety and protection for both the patient and themselves. The challenge lies in identifying and implementing appropriate protective measures when faced with a situation that deviates from standard protocol, potentially due to equipment malfunction or an unusual patient circumstance. Careful judgment is required to ensure that patient care is not compromised while adhering strictly to radiation safety principles. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient and operator safety by immediately ceasing the procedure and initiating a systematic investigation of the potential radiation exposure issue. This aligns with the fundamental principles of radiation protection, often referred to as ALARA, as low as reasonably achievable, which is a cornerstone of regulatory frameworks governing the use of ionizing radiation in healthcare. Specifically, it reflects the regulatory requirement to ensure that radiation exposure is minimized through appropriate shielding, technique, and equipment maintenance. By stopping the procedure, the RDA prevents unnecessary radiation exposure, reporting the issue to the supervising dentist and the facility's radiation safety officer, or equivalent, ensures that the problem is addressed by qualified personnel, leading to proper equipment assessment, potential repair, and adherence to established safety protocols. This proactive and communicative approach upholds ethical obligations to patient well-being and professional responsibility. Incorrect approach is analysis. Continuing the procedure without investigating the perceived issue is a significant regulatory and ethical failure. It directly violates the ALARA principle by potentially exposing the patient and operator to higher than necessary radiation levels. This approach demonstrates a disregard for established safety protocols and a lack of professional vigilance, which could lead to exceeding permissible dose limits and potential harm. Attempting to adjust exposure factors without understanding the root cause of the perceived issue is also a failure. This action is speculative and could inadvertently increase radiation exposure if the problem is not related to technique, but rather to equipment malfunction or improper collimation. It bypasses the necessary diagnostic step of identifying the actual problem and could lead to suboptimal image quality or increased radiation dose without a clear benefit. Ignoring the perceived issue and assuming it is insignificant is a critical ethical and regulatory lapse. It demonstrates a failure to recognize potential hazards and a lack of commitment to patient safety. This passive approach can lead to undetected equipment failures or procedural errors that result in cumulative radiation exposure over time, posing a long-term risk to both patients and staff. Professional reasoning. Professionals in this situation should employ a decision-making framework that begins with immediate risk assessment. Upon perceiving a deviation from expected radiation safety parameters, the first step is to pause and evaluate. This involves considering the potential for increased radiation exposure. The next step is to consult established protocols and, if necessary, cease the procedure to prevent further exposure. Communication is key. Reporting the observation to the supervising dentist and the designated radiation safety personnel is crucial for proper investigation and resolution. This systematic approach ensures that patient care is maintained while upholding the highest standards of radiation safety, as mandated by regulatory bodies and ethical guidelines. Question 7. Compliance review shows that during a patient education session, a registered dental assistant, RDA, was asked to explain the difference between a premolar and a molar. The RDA needs to accurately describe the tooth's type and function to the patient, Which of the following descriptions best reflects the RDA's required knowledge and communication skills? Option A. The premolar is the tooth that comes in after the primary incisors and before the wisdom teeth. Option B. The premolar is located behind the canine and in front of the molars, and it assists in grinding food, though it typically has fewer cusps than a molar. Option C. The premolar is a posterior tooth that helps with mastication. Option D. That tooth is a premolar, which is a type of molar. The correct answer is B. The premolar is located behind the canine and in front of the molars, and it assists in grinding food, though it typically has fewer cusps than a molar. Explanation. This scenario presents a professional challenge because a registered dental assistant, RDA, must accurately identify and communicate information about tooth types to a patient. Misidentification can lead to patient confusion, anxiety, and potentially impact their understanding of treatment plans or oral hygiene instructions. The challenge lies in translating technical dental terminology into understandable language while maintaining accuracy and adhering to professional standards. The correct approach represents best professional practice because it demonstrates the RDA's foundational knowledge of dental anatomy and their ability to apply it in patient education. Specifically, correctly identifying a premolar as distinct from a molar is crucial for accurate communication regarding its function, biting and grinding, and its typical role in orthodontic or restorative procedures. This aligns with the ethical obligation to provide clear, accurate, and understandable information to patients, fostering informed consent and trust. Regulatory frameworks for RDA certification emphasize competency in basic dental sciences, including tooth morphology and classification. An incorrect approach that misidentifies a premolar as a molar fails to meet the basic competency requirements for an RDA. This demonstrates a lack of fundamental knowledge, which is a direct regulatory failure. Ethically, it breaches the duty of care by providing inaccurate information, potentially leading to patient misunderstanding and suboptimal oral health decisions. Another incorrect approach that uses overly technical jargon without explanation would also be a failure, as it hinders patient comprehension and violates the principle of clear communication. Finally, an approach that dismisses the patient's question as unimportant shows a lack of professionalism and patient-centered care, which is often implicitly or explicitly covered in professional conduct guidelines. Professionals should approach such situations by first ensuring their own accurate identification of the tooth type based on its anatomical features, e.g., shape, cusps, location. They should then consider the patient's likely level of understanding and translate the technical term into simple, descriptive language, perhaps using visual aids if available. If unsure, the professional practice is to consult with the supervising dentist rather than providing potentially incorrect information. This decision-making process prioritizes patient safety, accurate communication, and adherence to professional standards. Question 8. Investigation of a patient's curiosity regarding the specific enzymatic and electrolyte composition of their saliva following a routine dental cleaning presents an ethical challenge for a registered dental assistant. The patient, having overheard a conversation about saliva's role in buffering acids, now wants to understand the precise chemical makeup of their own saliva. Option A. Offer a general statement that saliva is mostly water with some salts and enzymes, and then change the subject to the next patient's appointment. Option B. Explain that saliva contains enzymes like amylase and lysozyme, and electrolytes such as sodium, potassium, and chloride, but that a detailed biochemical breakdown is beyond the scope of an RDA's expertise, and recommend they discuss specific salivary composition with their dentist for a comprehensive explanation. Option C. Provide a detailed, in-depth explanation of the complex biochemical pathways involved in salivary secretion and the precise concentrations of all known salivary proteins and ions, drawing from general scientific literature. Option D. State that such detailed information is not relevant to their dental care and that they should focus on brushing and flossing. The correct answer is B. Explain that saliva contains enzymes like amylase and lysozyme, and electrolytes such as sodium, potassium, and chloride, but that a detailed biochemical breakdown is beyond the scope of an RDA's expertise, and recommend they discuss specific salivary composition with their dentist for a comprehensive explanation. Explanation. Scenario analysis. This scenario presents an ethical dilemma for a registered dental assistant, RDA, concerning patient autonomy and the scope of practice when a patient requests information beyond their direct clinical care. The patient's inquiry about the specific biochemical composition of their saliva, while related to salivary gland function, delves into a level of detail that an RDA is not typically trained or authorized to provide. The challenge lies in balancing the patient's desire for knowledge with the RDA's professional responsibilities and limitations. Ensuring accurate information is conveyed without overstepping professional boundaries or providing potentially misleading details. Correct approach analysis. The correct approach involves acknowledging the patient's interest, validating their curiosity, and then redirecting them to the appropriate professional for detailed scientific information. This upholds the principle of patient-centered care by respecting their desire to learn while adhering to the scope of practice for an RDA. By suggesting the dentist or a specialist, the RDA ensures the patient receives accurate, comprehensive, and professionally sanctioned information. This aligns with ethical guidelines that emphasize honesty, competence, and the importance of referring to qualified professionals when necessary. Regulatory frameworks for RDAs typically define their scope of practice, which does not include in-depth biochemical analysis or explanation of salivary composition. Incorrect approaches analysis. One incorrect approach involves attempting to provide a detailed biochemical explanation. This is professionally unacceptable because it likely exceeds the RDA's knowledge base and scope of practice. Providing inaccurate or incomplete information could mislead the patient, potentially impacting their understanding of their oral health or treatment. This violates the ethical duty of competence and honesty. Another incorrect approach is to dismiss the patient's question outright without explanation. This is unprofessional and erodes patient trust. While the RDA may not be able to answer the specific question, ignoring it is a failure to communicate effectively and respectfully with the patient, which is a cornerstone of ethical dental practice. A third incorrect approach is to speculate or guess the biochemical composition. This is highly unethical and dangerous. Speculation can lead to misinformation and potentially harmful decisions by the patient. It directly contradicts the requirement for accuracy and professional integrity in healthcare. Professional reasoning. When faced with a patient inquiry that falls outside one's direct expertise or scope of practice, the professional decision-making process involves 1. Active listening and validation. Acknowledge the patient's question and their interest. 2. Scope of practice assessment. Determine if the question falls within your authorized duties and knowledge. 3. Information provision if within scope. Provide accurate and concise information as permitted. 4. Referral if outside scope. Politely and clearly explain that the information is best provided by a dentist or specialist and facilitate that referral if possible. 5. Documentation. Note the patient's inquiry and the action taken in the patient's record. This systematic approach ensures patient well-being, maintains professional integrity, and adheres to regulatory and ethical standards. Question 9. What factors determine the appropriate selection and handling of a dental restorative material to ensure its longevity, patient comfort, and biocompatibility in the oral environment? Option A. The physical, chemical, and biological properties of the material, along with adherence to manufacturer's instructions for use. Option B. The cost-effectiveness of the material and its availability in the dental supply closet. Option C. The dentist's personal preference and the material's setting time. Option D. The aesthetic appeal of the material and its ease of manipulation by the dental team. The correct answer is A. The physical, chemical, and biological properties of the material, along with adherence to manufacturer's instructions for use. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered dental assistant, RDA, to apply knowledge of dental material properties to a practical clinical situation. The RDA must consider not only the immediate needs of the patient and the dentist, but also the long-term success of the dental restoration and the patient's oral health. Misjudging the properties of a dental material can lead to restoration failure, patient discomfort, and potential need for remakes, impacting both patient care and practice efficiency. The RDA's role in material selection and handling is crucial for ensuring the longevity and efficacy of dental treatments. Correct approach analysis. The correct approach emphasizes understanding the physical properties, e.g., strength, hardness, wear resistance, and chemical properties, e.g., solubility, setting reaction, corrosion resistance, of the chosen restorative material. This knowledge directly informs how the material will perform in the oral environment, its handling characteristics during placement, and its ability to withstand occlusal forces and chemical challenges. Furthermore, considering the biological properties, e.g., biocompatibility, potential for pulpal irritation, allergenic potential, is paramount for patient safety and to prevent adverse tissue reactions. Adherence to manufacturer's instructions for use, which are based on these material properties, ensures optimal performance and compliance with regulatory guidelines for dental materials. This approach represents best professional practice by prioritizing patient well-being, treatment success, and adherence to established standards of care, as mandated by the regulatory framework governing RDAs. Incorrect approaches analysis. One incorrect approach focuses solely on the aesthetic appearance of the material without adequate consideration for its physical or biological properties. This is a regulatory failure because it neglects the fundamental requirements for a successful and safe restoration, potentially leading to premature failure or adverse biological responses, which violates the duty of care owed to the patient. Another incorrect approach prioritizes the ease of manipulation for the dental team over the material's inherent properties and patient outcomes. This is an ethical failure, as it places convenience above patient health and the quality of care, potentially compromising the integrity of the restoration and patient comfort. A third incorrect approach involves selecting a material based on cost alone, disregarding its suitability for the specific clinical application and its physical, chemical, and biological characteristics. This is a significant ethical and regulatory failure, as it can lead to the use of substandard materials that are not appropriate for the oral environment, jeopardizing patient health and the long-term success of the dental work. Professional reasoning. Professionals should approach material selection and handling by first identifying the clinical requirements of the procedure. This involves understanding the location of the restoration, the forces it will encounter, and the desired longevity. Next, the RDA must consult reliable resources, including manufacturer's instructions and evidence-based literature, to understand the physical, chemical, and biological properties of potential materials. The chosen material should then be handled strictly according to the manufacturer's guidelines, which are designed to optimize its properties and ensure safe and effective use. Finally, continuous professional development and staying updated on new materials and techniques are essential for maintaining competence and providing the highest standard of patient care, in line with regulatory expectations. Question 10. When evaluating the transition from traditional film radiography to digital radiography for a dental practice, what is the primary regulatory consideration for a registered dental assistant to ensure compliance and patient safety? Option A. Prioritizing the digital radiography system with the lowest initial purchase price to maximize cost savings for the practice. Option B. Selecting a digital radiography system based on the manufacturer's claims of speed and ease of use, without independent verification of diagnostic quality or regulatory compliance. Option C. Implementing the digital radiography system that offers the most advanced features, regardless of whether these features are explicitly required by current regulations or contribute to diagnostic accuracy. Option D. Verifying that the digital radiography system meets or exceeds the diagnostic image quality standards equivalent to or better than traditional film, complies with radiation safety protocols, and adheres to patient data privacy and security regulations. The correct answer is D. Verifying that the digital radiography system meets or exceeds the diagnostic image quality standards equivalent to or better than traditional film, complies with radiation safety protocols, and adheres to patient data privacy and security regulations. Explanation. Scenario analysis. This scenario presents a common challenge in dental radiography, balancing technological advancement with established regulatory compliance and patient care standards. A registered dental assistant, RDA, must understand the implications of transitioning to digital radiography, not just in terms of workflow efficiency, but also in relation to patient safety, data security, and the specific requirements mandated by the licensing board. Challenge lies in ensuring that the chosen digital system meets or exceeds the standards set for traditional film radiography in terms of diagnostic quality, radiation dose reduction, and record keeping, all while adhering to any specific regulations governing the use and maintenance of digital imaging equipment. Correct approach analysis. The correct approach prioritizes adherence to the specific regulations governing dental radiography in the jurisdiction. This involves verifying that the chosen digital radiography system meets or exceeds the diagnostic image quality standards equivalent to or better than traditional film, as required by the licensing board. Furthermore, it necessitates ensuring the system complies with radiation safety protocols, including dose optimization and proper equipment maintenance, as outlined in state or provincial regulations. Patient data privacy and security, governed by laws like HIPAA in the U.S., are also paramount. The RDA must confirm that the digital system's software and hardware facilitate secure storage, retrieval, and transmission of patient images and records, aligning with all applicable privacy mandates. This comprehensive approach ensures both patient safety and legal compliance. Incorrect approaches analysis. Choosing a digital radiography system solely based on cost savings without verifying its diagnostic quality or compliance with radiation safety regulations is a significant regulatory and ethical failure. This approach risks producing images of insufficient diagnostic value, potentially leading to misdiagnosis or the need for retakes, which increases patient radiation exposure unnecessarily. It also violates the principle of providing the highest standard of care. Selecting a digital system without considering patient data security and privacy protocols, such as those mandated by HIPAA, is another critical failure. This can lead to breaches of confidential patient information, resulting in severe legal penalties and erosion of patient trust. The regulatory framework explicitly requires the protection of patient health information. Adopting a digital system without ensuring it meets the same or higher diagnostic image quality standards as traditional film, as determined by the licensing board, is a direct violation of professional practice guidelines. The purpose of radiography is diagnostic, and any system that compromises this fundamental purpose is unacceptable. This failure undermines the diagnostic efficacy of dental treatment. Professional reasoning. When evaluating new technologies like digital radiography, an RDA should employ a systematic decision-making process. First, identify the core professional and regulatory requirements for dental radiography in the specific jurisdiction, focusing on diagnostic quality, radiation safety, and patient data protection. Second, research available digital radiography systems, comparing their technical specifications against these requirements. Third, consult the relevant state or provincial dental board regulations and any applicable federal laws, e.g., HIPAA in the U.S., to ensure full compliance. Fourth, prioritize systems that demonstrably meet or exceed established standards for image quality and radiation dose reduction. Fifth, confirm that the chosen system has robust data security and privacy features. Finally, ensure adequate training for all staff on the proper operation and maintenance of the new system, reinforcing ongoing compliance. Question 11. System analysis indicates that a dental assistant has discovered a container of expired dental amalgam in the operatory. The assistant needs to ensure this material is handled and disposed of according to all applicable regulations. Which of the following actions best represents the appropriate professional practice for managing this hazardous material? Option A. Segregate the expired amalgam into a clearly labeled hazardous waste container and arrange for disposal through a licensed hazardous waste management service. Option B. Rinse the expired amalgam down the operatory sink to dilute any potential mercury. Option C. Store the expired amalgam in an unmarked container in a supply closet until a convenient time for disposal. Option D. Place the expired amalgam in the general office trash bin for regular waste disposal. The correct answer is A. Segregate the expired amalgam into a clearly labeled hazardous waste container and arrange for disposal through a licensed hazardous waste management service. Explanation. Scenario analysis. A dental assistant is tasked with managing hazardous materials, specifically expired or contaminated dental amalgam. This scenario is professionally challenging because improper handling can lead to environmental contamination, pose health risks to staff and patients, and result in significant legal and regulatory penalties. The assistant must possess a thorough understanding of state and federal regulations governing hazardous waste, as well as the clinic's internal protocols for safe disposal. The potential for exposure to mercury, a neurotoxin, necessitates strict adherence to safety procedures. Correct approach analysis. The correct approach involves segregating the expired amalgam waste into a designated, leak-proof container clearly labeled as hazardous waste, specifically identifying it as mercury-containing waste. This container should then be stored in a secure area away from general waste and patient care areas. The next crucial step is to contact a licensed hazardous waste disposal company that specializes in handling dental amalgam. This ensures that the waste is transported and disposed of in compliance with all applicable Environmental Protection Agency (EPA) regulations and state-specific hazardous waste management laws. This method represents best professional practice because it directly addresses the regulatory requirements for hazardous waste identification, containment, storage, and disposal, thereby minimizing environmental impact and protecting public health. It aligns with the principles of responsible waste management and demonstrates a commitment to ethical practice by prioritizing safety and regulatory compliance. Incorrect approaches analysis. One incorrect approach is to dispose of the expired amalgam in the regular trash. This is a significant regulatory and ethical failure. It violates EPA regulations, e.g., Resource Conservation and Recovery Act (RCRA), and state environmental laws that classify mercury-containing waste as hazardous. This action creates a direct risk of environmental contamination and potential harm to sanitation workers. Another incorrect approach is to rinse the amalgam down the sink. This is also a severe regulatory and ethical failure. Mercury is a heavy metal that can contaminate water systems and harm aquatic life. Plumbing systems are not designed to handle such hazardous materials, and this action would violate Clean Water Act provisions and local wastewater discharge regulations. A third incorrect approach is to store the expired amalgam in an unmarked container in a general storage closet. This fails to meet the regulatory requirement for proper labeling and containment of hazardous waste. It increases the risk of accidental exposure or improper disposal due to lack of clear identification. Ethically, it demonstrates a lack of diligence in protecting staff and the environment from potential hazards. Professional reasoning. Professionals in dental assisting must adopt a proactive and informed approach to hazardous material management. This involves staying current with all relevant federal, state, and local regulations pertaining to dental waste. When faced with a situation involving hazardous materials like expired amalgam, the decision-making process should begin with identifying the material and its hazardous properties. Next, consult the clinic's waste management plan and relevant regulatory guidelines to determine the appropriate handling, segregation, labeling, storage, and disposal procedures. If unsure, always err on the side of caution and seek guidance from a supervisor or a designated environmental compliance officer. Prioritizing regulatory compliance and environmental stewardship is paramount to maintaining professional integrity and ensuring public safety. Question 12. The control framework reveals that when preparing for a procedure involving the posterior palate and the floor of the mouth, an RDA must accurately identify and describe the key anatomical structures within these regions. Which of the following best describes the primary anatomical features of the tongue, palate, and floor of the mouth relevant to dental procedures? Option A. The tongue is a salivary gland located under the jaw, the palate is the uvula, and the floor of the mouth is the epiglottis. Option B. The tongue is a bony structure located at the back of the throat, the palate is the outer lining of the teeth, and the floor of the mouth is a collection of nerves responsible for sensation. Option C. The tongue is a muscular organ crucial for taste, speech, and manipulating food. The palate consists of the hard palate, anterior bony portion, and the soft palate, posterior muscular portion, forming the roof of the mouth, and the floor of the mouth is primarily composed of muscles like the myloioid and genioid, supporting the tongue and housing salivary glands. Option D. The tongue is a cartilaginous flap that covers the airway. The palate is the gum tissue surrounding the teeth, and the floor of the mouth is the area behind the tonsils. The correct answer is C. The tongue is a muscular organ crucial for taste, speech, and manipulating food. The palate consists of the hard palate, anterior bony portion, and the soft palate, posterior muscular portion, forming the roof of the mouth, and the floor of the mouth is primarily composed of muscles like the myloioid and genioid, supporting the tongue and housing salivary glands. Explanation. The control framework reveals that a registered dental assistant (RDA) must possess a comprehensive understanding of oral cavity structures to effectively assist the dentist and ensure patient safety. This scenario is professionally challenging because it requires the RDA to not only identify anatomical landmarks, but also to understand their functional significance and potential implications for dental procedures. Accurate identification and understanding are critical for proper instrument selection, procedural execution, and anticipating potential complications. The correct approach represents best professional practice because it demonstrates the RDA's ability to accurately identify and articulate the specific structures of the oral cavity relevant to a dental procedure. This aligns with the core competencies expected of an RDA, which include assisting in diagnosis and treatment planning by providing accurate anatomical information. Adherence to the regulatory framework for registered dental assistant certification mandates this level of anatomical knowledge as a prerequisite for safe and effective practice. An incorrect approach that focuses solely on a general description of the oral cavity without specifying the requested structures fails to meet the specific diagnostic and procedural needs of the situation. This demonstrates a lack of precise anatomical knowledge, which could lead to errors in instrument handling or procedural guidance, potentially compromising patient care and violating the standard of care expected under the regulatory framework. Another incorrect approach that misidentifies or conflates the functions of the tongue, palate, and floor of the mouth indicates a fundamental deficiency in anatomical understanding. Such errors could lead to incorrect assumptions about tissue manipulation, anesthesia administration, or the placement of dental materials, posing a direct risk to the patient and a clear violation of the professional standards and ethical obligations governing RDAs. A further incorrect approach that prioritizes a superficial description over functional relevance overlooks the practical application of anatomical knowledge in a clinical setting. While general knowledge is a starting point, the ability to connect anatomical structures to their roles in mastication, speech, and their susceptibility to disease or injury is essential for an RDA to effectively support the dentist. This failure to integrate functional understanding with anatomical identification represents a gap in competency as defined by the certification requirements. The professional decision-making process for similar situations should involve a systematic approach. First, carefully read and understand the specific anatomical structures being queried. Second, access and apply the knowledge gained during certification training regarding the precise location, characteristics, and functions of these structures. Third, consider the clinical context of the question to ensure the answer is relevant to potential dental procedures or patient conditions. Finally, articulate the answer clearly and accurately, reflecting the depth of understanding required by the regulatory framework. Question 13. The assessment process reveals that a registered dental assistant is preparing an operatory for a patient requiring a dental filling. Which of the following actions best demonstrates adherence to regulatory requirements for infection control and patient safety in California? Option A. Ensuring all instruments are sterilized according to manufacturer instructions and state guidelines, disinfecting all surfaces that may have been contaminated, and donning appropriate personal protective equipment before patient entry. Option B. Briefly rinsing instruments under running water and proceeding with the procedure, assuming no visible contamination is present. Option C. Using only gloves and a mask for the dental assistant, but not for the patient, and only disinfecting the immediate work area. Option D. Relying on the patient to inform the dental team if they have any infectious diseases, and only sterilizing instruments if they appear visibly soiled. The correct answer is A. Ensuring all instruments are sterilized according to manufacturer instructions and state guidelines, disinfecting all surfaces that may have been contaminated, and donning appropriate personal protective equipment before patient entry. Explanation. Scenario analysis. A registered dental assistant, RDA, is tasked with preparing a patient for a restorative procedure, specifically a filling. This scenario is professionally challenging because it requires the RDA to not only understand the technical aspects of assisting, but also to adhere strictly to infection control protocols and patient safety guidelines mandated by the dental board. Failure to do so can compromise patient health and lead to regulatory violations. Correct approach analysis. The correct approach involves meticulously following established infection control protocols, including proper sterilization of instruments, disinfection of the operatory, and appropriate personal protective equipment, PPE, for both the patient and the dental team. This aligns with the Dental Practice Act and the California Code of Regulations, which outline specific requirements for infection control to prevent the transmission of infectious diseases, Adhering to these guidelines ensures patient safety, protects the dental team, and maintains compliance with state law. Incorrect approaches analysis. One incorrect approach involves skipping or inadequately performing sterilization procedures for instruments used during the filling. This directly violates infection control regulations, such as those found in the California Dental Practice Act, which mandate that all instruments be properly cleaned, disinfected, and sterilized between patients. Such negligence poses a significant risk of cross-contamination and infection transmission, leading to disciplinary action by the dental board. Another incorrect approach is failing to use appropriate PPE, such as gloves, masks, and eye protection, for both the RDA and the patient. Regulations clearly stipulate the use of PPE to create a barrier against potential pathogens. Not using PPE is a breach of these safety standards and exposes individuals to unnecessary health risks, which is a violation of occupational safety and health guidelines applicable to dental settings. A third incorrect approach is neglecting to properly disinfect the operatory surfaces after the procedure. This is a critical step in infection control, as outlined in state regulations, to eliminate any residual microorganisms. Failure to disinfect surfaces can lead to the spread of infection to subsequent patients, constituting a serious regulatory and ethical lapse. Professional reasoning. Professionals should approach this situation by prioritizing patient safety and regulatory compliance above all else. This involves a thorough understanding of the specific infection control protocols mandated by the California Dental Board and the Dental Practice Act. A systematic checklist approach to preparing the operatory and instruments, coupled with continuous vigilance regarding PPE and disinfection, ensures that all steps are completed correctly and safely. When in doubt about a specific protocol, consulting the relevant regulations or a supervising dentist is essential. Question 14. Risk assessment procedures indicate that a patient presenting for a routine dental cleaning may have undiagnosed respiratory illness, increasing the potential for aerosol generation and droplet transmission. The dental assistant is preparing the operatory for the procedure. Which of the following represents the most appropriate and comprehensive approach to personal protective equipment, PPE, selection and utilization in this scenario? Option A. Rely on the dentist to select the appropriate PPE for the operatory as they are the primary clinician. Option B. Wear gloves, a fluid-resistant mask with a high filtration efficiency, eye protection e.g., safety glasses or a face shield, and a protective gown or lab coat. Option C. Wear only gloves and ensure good hand hygiene before and after the procedure. Option D. Don gloves and a surgical mask, as these are standard for most dental procedures. The correct answer is D. Don gloves and a surgical mask, as these are standard for most dental procedures. Explanation. This scenario is professionally challenging because it requires immediate and accurate application of standard precautions and personal protective equipment, PPE, in a dynamic clinical environment where patient safety and healthcare worker safety are paramount. The dental assistant must not only identify the potential risks, but also select and utilize the appropriate PPE to mitigate those risks effectively, all while maintaining patient comfort and procedural efficiency. This demands a thorough understanding of infectious disease transmission pathways and the protective capabilities of various PPE items. The correct approach represents best professional practice because it prioritizes the most effective and comprehensive method of preventing the transmission of infectious agents by selecting PPE that creates a barrier against anticipated splashes, aerosols, and direct contact with potentially infectious materials. The dental assistant is adhering to the fundamental principles of standard precautions. This aligns directly with the regulatory framework for registered dental assistants, which mandates the use of appropriate PPE to protect both the patient and the healthcare provider from bloodborne pathogens and other microorganisms. This proactive measure is crucial for maintaining a safe clinical environment and preventing healthcare-associated infections. An incorrect approach that involves using only gloves without considering other potential exposures fails to address the risk of aerosol generation or splashes to mucous membranes and skin. This is a regulatory failure, as it demonstrates a lack of adherence to the comprehensive requirements of standard precautions, which necessitate protection against all potential routes of transmission. Another incorrect approach, such as relying solely on the dentist's PPE selection without independent assessment, represents a failure in professional responsibility and ethical practice. The dental assistant has a direct duty to ensure their own safety and contribute to the overall safety of the operatory. Furthermore, an approach that involves using PPE that is not designed for the specific procedure, such as using a mask that does not offer adequate filtration for aerosol-generating procedures, is a significant safety and regulatory failure, as it provides a false sense of security while leaving the healthcare worker vulnerable. The professional decision-making process for similar situations should involve a systematic risk assessment. This begins with identifying the procedure being performed and the potential for exposure to blood, bodily fluids, non-intact skin, and mucous membranes. Based on this assessment, the dental assistant should then select the appropriate PPE, which may include gloves, masks, eye protection, and protective clothing, ensuring each item is suitable for the anticipated level of exposure. Regular review and updating of knowledge regarding standard precautions and PPE guidelines are essential to maintain best practices. Question 15. Governance review demonstrates that a registered dental assistant (RDA) is preparing an operatory for a patient requiring a routine procedure. The RDA notices that the sterilization unit is running slightly behind schedule due to a higher than anticipated patient load. The RDA has a limited amount of time before the patient is seated. Which of the following actions best upholds the principles of infection control as mandated by U.S. regulatory frameworks for dental assisting? Option A. Utilize a rapid surface disinfectant on all operatory surfaces and proceed with the procedure, assuming that any minor delays in instrument sterilization will not pose a significant risk for this routine procedure. Option B. Clean and disinfect all operatory surfaces, and then proceed with the procedure using only instruments that have been properly sterilized according to manufacturer instructions and regulatory guidelines, even if it means a slight delay for the patient. Option C. Reprocess the instruments that are currently in the sterilization unit by running a shorter cycle, and then proceed with the procedure once those instruments are available. Option D. Proceed with the procedure after a thorough disinfection of all critical and semi-critical surfaces, ensuring all instruments used are from a pre-sterilized batch that was processed earlier in the day. The correct answer is D. Proceed with the procedure after a thorough disinfection of all critical and semi-critical surfaces, ensuring all instruments used are from a pre-sterilized batch that was processed earlier in the day. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a registered dental assistant (RDA) to balance immediate patient care needs with strict adherence to infection control protocols. The urgency of a procedure can sometimes create pressure to bypass or shorten steps, but failure to maintain aseptic technique can have severe consequences for patient safety, leading to preventable infections and potential legal ramifications. The RDA must exercise sound judgment and prioritize safety over expediency. Correct approach analysis. The correct approach, which involves meticulously following the established protocol for instrument sterilization and surface disinfection, represents best professional practice. This aligns directly with the principles of infection control mandated by regulatory bodies governing dental assisting in the United States. Specifically, guidelines from the Centers for Disease Control and Prevention (CDC) and state dental boards emphasize the critical importance of proper sterilization and disinfection to prevent the transmission of infectious agents. Adhering to these protocols ensures patient safety, protects the dental team, and upholds the ethical obligation to provide competent and safe care. Incorrect approaches analysis. One incorrect approach involves proceeding with the procedure after only a cursory wipe down of surfaces, assuming that the instruments themselves are sterile. This fails to address the risk of cross-contamination from environmental surfaces, which can harbor pathogens. Regulatory failure lies in neglecting the comprehensive disinfection requirements for operatory surfaces, as outlined by infection control guidelines. Ethically, this demonstrates a disregard for patient safety by not mitigating all potential routes of transmission. Another incorrect approach is to reuse disposable barriers on instruments or equipment without proper sterilization or disposal. Disposable items are designed for single use to prevent cross-contamination. Reusing them bypasses critical infection control steps and creates a significant risk of pathogen transfer between patients. This is a direct violation of infection control standards and poses a serious ethical breach due to the direct harm it could cause. A third incorrect approach is to delay sterilization of instruments until the end of the day, instead of processing them immediately after use. This practice allows microorganisms to proliferate on contaminated instruments, increasing the risk of transmission and potentially compromising the effectiveness of the sterilization process. Regulatory failure occurs by not adhering to the recommended timelines for instrument cleaning and sterilization, which are crucial for effective microbial kill. Ethically, this approach prioritizes convenience over the immediate safety of subsequent patients. Professional reasoning. Professionals should approach such situations by first recognizing that infection control is non-negotiable. A decision-making framework would involve 1. Understanding and internalizing all relevant infection control protocols and regulations. 2. Performing a rapid risk assessment of the situation, considering the potential for exposure and the necessary protective measures. 3. Prioritizing patient and team safety above all else, even under time pressure. 4. Communicating any concerns or perceived shortcuts to the supervising dentist. 5. Consistently applying aseptic techniques and adhering to established sterilization and disinfection procedures for every patient, every time. Question 16. The monitoring system demonstrates that a 7-year-old patient presents with several primary teeth still in place, alongside newly erupted permanent incisors and first molars. The dental arches appear to be developing, with some spacing noted between the anterior teeth. Based on the typical sequence of tooth development and eruption for this age, what is the most appropriate observation and documentation for the registered dental assistant? Option A. Document the findings without further comment, assuming that any deviations from the ideal eruption sequence are not within the scope of the RDA's responsibility to report or interpret. Option B. Immediately alert the supervising dentist to the presence of retained primary teeth, as this indicates a potential delay in permanent tooth eruption that requires urgent intervention. Option C. Record the findings as abnormal, suggesting that the patient is experiencing significant developmental delays in both tooth eruption and arch formation, and recommend immediate orthodontic consultation. Option D. Document the presence of mixed dentition, noting the eruption of permanent incisors and first molars alongside retained primary teeth, and observe the spacing in the anterior arch as a common characteristic of this developmental stage. The correct answer is D. Document the presence of mixed dentition, noting the eruption of permanent incisors and first molars alongside retained primary teeth, and observe the spacing in the anterior arch as a common characteristic of this developmental stage. Explanation. The monitoring system demonstrates a need for a registered dental assistant RDA to understand the developmental stages of teeth and dental arches to ensure appropriate patient care and documentation. This scenario is professionally challenging because misinterpreting or failing to recognize normal developmental variations can lead to unnecessary interventions, incorrect treatment planning, or inadequate patient education. A deep understanding of embryology and odontogenesis is crucial for an RDA to accurately assess a patient's oral development. The correct approach involves recognizing the patient's age and correlating it with expected tooth eruption patterns and the development of the dental arches. This aligns with the RDA's role in assisting the dentist with diagnosis and treatment by providing accurate observational data. Best professional practice dictates that the RDA should document findings that are consistent with normal developmental milestones for the patient's age, thereby supporting the dentist's assessment and ensuring the patient receives appropriate care based on their developmental stage. This adheres to the ethical obligation to provide competent care and maintain accurate patient records, as mandated by the regulatory framework governing RDAs. An incorrect approach would be to immediately flag any deviation from a textbook ideal as a problem without considering the patient's age and the wide range of normal variation in tooth development and eruption. This could lead to unnecessary anxiety for the patient and parents, and potentially lead to premature or inappropriate diagnostic procedures or treatments. Another incorrect approach would be to ignore the findings altogether, failing to document them, which would be a dereliction of duty and could hinder the dentist's ability to track the patient's development over time. Failing to consult with the supervising dentist when uncertain about developmental findings is also a critical failure, as it bypasses the established hierarchy of care and the dentist's ultimate responsibility for diagnosis and treatment planning. The professional decision-making process for similar situations should involve a systematic approach. First, Identify the patient's age. Second, recall or reference the expected developmental milestones for that age regarding tooth eruption and arch formation. Third, compare the observed findings with these expected milestones, acknowledging the inherent variability. Fourth, document all findings accurately and objectively. And finally, consult with the supervising dentist if any findings are outside the expected range of normal or if there is any uncertainty. Question 17. The efficiency study reveals that the dental practice is experiencing challenges in effectively managing its regulated medical waste. Considering the potential risks and regulatory requirements, which of the following waste management strategies best aligns with best professional practice and regulatory compliance for a registered dental assistant? Option A. Delegate the responsibility for managing all regulated medical waste, including its segregation and disposal, solely to the janitorial staff, without providing them with specific training on medical waste handling protocols. Option B. Consolidate all waste, including sharps and potentially infectious materials, into the general trash bins to streamline disposal processes and reduce the number of waste containers. Option C. Store all regulated medical waste in a single, unmarked container in a designated area, assuming the waste disposal company will handle the segregation and proper disposal. Option D. Implement a comprehensive waste management plan that includes clear protocols for segregating, labeling, storing, and disposing of all waste streams, with specific attention to sharps and potentially infectious materials, ensuring compliance with federal and state regulations. The correct answer is D. Implement a comprehensive waste management plan that includes clear protocols for segregating, labeling, storing, and disposing of all waste streams, with specific attention to sharps and potentially infectious materials, ensuring compliance with federal and state regulations. Explanation: the efficiency study reveals a potential gap in the dental practice's waste management protocols, specifically concerning the segregation and disposal of regulated medical waste. This scenario is professionally challenging because improper waste management poses significant risks to public health, environmental safety, and can lead to severe legal and financial penalties for the practice and its staff. A registered dental assistant, RDA, must possess a thorough understanding of these risks and the applicable regulations to ensure compliance and protect all stakeholders. Careful judgment is required to identify the most effective and compliant waste management strategy. The correct approach represents best professional practice because it prioritizes the safe and compliant handling of regulated medical waste, aligning with established public health and environmental protection standards. This involves a proactive risk assessment to identify all potential waste streams, understand their specific disposal requirements, and implement a system that ensures proper segregation, containment, labeling, and disposal according to federal and state regulations. This approach minimizes the risk of exposure to infectious agents, prevents environmental contamination, and avoids legal repercussions. An incorrect approach that involves disposing of all waste, including sharps and potentially infectious materials, in the general trash is a direct violation of federal and state regulations governing medical waste. This poses a severe risk of injury to waste handlers and the public, and significantly increases the potential for disease transmission. Another incorrect approach, such as storing all regulated medical waste in a single, unmarked container, fails to meet labeling requirements mandated by regulatory bodies. This lack of clear identification can lead to improper handling and disposal by waste management services, potentially resulting in non-compliance and environmental hazards. Finally, an approach that relies solely on the janitorial staff to manage regulated medical waste without proper training or oversight is a critical failure. Regulatory frameworks place the responsibility for compliant waste management squarely on the healthcare facility and its licensed professionals, including RDAs. Delegating this responsibility without ensuring proper training and adherence to protocols is a breach of professional duty and regulatory requirements. Professional decision-making in similar situations should involve a systematic risk assessment process. This begins with identifying all types of waste generated, categorizing them according to regulatory definitions, e.g., general waste, regulated medical waste, sharps, hazardous waste. Next, professionals must consult the relevant federal, e.g., EPA, OSHA, and state-specific dental board regulations and guidelines to understand the specific requirements for each waste category. This includes understanding proper segregation techniques, appropriate containment and labeling, storage limitations, and approved disposal methods. Finally, implementing a robust training program for all staff involved in waste handling and establishing regular audits to ensure ongoing compliance are crucial steps in maintaining a safe and legally sound waste management system. Question 18. Stakeholder feedback indicates a need to assess the practical knowledge of registered dental assistants regarding the diverse range of dental materials encountered in practice. Which of the following best demonstrates an understanding of the fundamental properties and clinical applications of common dental materials used in restorative dentistry? Option A. The selection of dental materials based solely on their perceived cost-effectiveness, prioritizing lower-cost options regardless of their suitability for the specific patient's oral condition or the dentist's treatment plan. Option B. The ability to differentiate between various restorative materials based on their physical properties, setting mechanisms, and typical indications for use in different clinical scenarios. Option C. Reliance on personal preference and anecdotal information from colleagues when choosing dental materials, rather than consulting established clinical guidelines or the dentist's specific instructions. Option D. A primary focus on the aesthetic characteristics of dental materials, such as color matching and surface texture, without significant consideration for their functional longevity or biocompatibility. The correct answer is B. The ability to differentiate between various restorative materials based on their physical properties, setting mechanisms, and typical indications for use in different clinical scenarios. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a registered dental assistant, RDA, to interpret and apply knowledge of various dental materials in a practical setting, directly impacting patient care and safety. The challenge lies in understanding the properties, indications, contraindications, and potential adverse reactions of these materials to ensure appropriate selection and application under the supervision of a licensed dentist. Misapplication or misunderstanding of material properties can lead to treatment failure, patient discomfort, or even harm, necessitating a thorough understanding of the regulatory framework governing dental materials and their use. Correct approach analysis. The correct approach involves demonstrating a comprehensive understanding of the properties, clinical applications, and potential limitations of common dental materials. This aligns with the core competencies expected of an RDA, which include assisting in restorative procedures and understanding the materials used. Best professional practice dictates that an RDA should be able to identify materials based on their characteristics and understand their role in different dental treatments, ensuring they can effectively support the dentist and provide safe patient care. This knowledge is fundamental to fulfilling the responsibilities outlined in the Registered Dental Assistant Certification requirements, which implicitly cover the safe and effective use of materials within the scope of practice. Incorrect approach is analysis. One incorrect approach would be to focus solely on the aesthetic qualities of dental materials without considering their functional properties, biocompatibility, or longevity. This is a regulatory failure because it neglects the primary purpose of dental materials, which is to restore oral function and health, not just appearance. Ethically, it prioritizes superficial outcomes over patient well-being. Another incorrect approach would be to prioritize the cost-effectiveness of materials above all else, regardless of their suitability for the specific clinical situation or patient needs. This is a regulatory and ethical failure, as it can lead to the use of substandard materials that may compromise treatment outcomes and patient safety, violating the principle of providing the best possible care. A third incorrect approach would be to rely on anecdotal evidence or personal preference when selecting materials, rather than adhering to evidence-based practices and dentist's instructions. This is a significant professional failing, as it bypasses established clinical protocols and the dentist's ultimate responsibility for treatment planning and material selection, potentially leading to inappropriate material use and patient harm. Professional reasoning. Professionals should approach this by first understanding the scope of practice for an RDA, which includes assisting with restorative procedures and understanding the materials involved. This requires continuous learning and staying updated on material science as it pertains to dentistry. When faced with a question about dental materials, the decision-making process should involve recalling fundamental principles of material properties, their intended clinical uses, and any known contraindications or precautions. This knowledge should be applied to the specific context presented in the question, evaluating each option against established dental knowledge and regulatory expectations for RDAs. The goal is to identify the option that best reflects a competent and safe application of dental material knowledge within the RDA's role. Question 19. Strategic planning requires that a registered dental assistant (RDA) meticulously review and confirm a dentist's prescription for dental radiographs. Which of the following actions best exemplifies adherence to regulatory requirements and professional best practices for an RDA when presented with a radiographic prescription? Option A. Verify the written prescription for accuracy and clinical appropriateness, and if any concerns arise, discreetly discuss them with the dentist before proceeding. Option B. Question the dentist's prescription directly in front of the patient, suggesting it might be unnecessary. Option C. Verbally confirm the prescription with the dentist and immediately take the radiograph. Option D. Proceed with taking the radiograph as prescribed, assuming the dentist has a valid clinical reason. The correct answer is D. Proceed with taking the radiograph as prescribed, assuming the dentist has a valid clinical reason. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent responsibility of a registered dental assistant (RDA) to ensure patient safety and diagnostic accuracy when performing radiographic procedures. The challenge lies in balancing the need for timely patient care with the strict adherence to radiation safety protocols and the specific requirements of the governing dental board. Misinterpreting or failing to adhere to these regulations can lead to compromised patient care, legal repercussions, and ethical violations. Correct approach analysis. The correct approach emphasizes the RDA's responsibility to verify the accuracy and appropriateness of the prescribed radiographic examination before proceeding. This aligns with the principle of professional accountability and patient advocacy. Regulatory frameworks for RDAs typically mandate that dental professionals act within their scope of practice and ensure that procedures are clinically indicated. Verifying the prescription ensures that the radiograph serves a legitimate diagnostic purpose, minimizes unnecessary radiation exposure to the patient, and upholds the quality of care expected from a licensed professional. This proactive step prevents potential errors and ensures compliance with standards of care. Incorrect approaches analysis. One incorrect approach involves proceeding with the radiograph solely based on the dentist's verbal instruction without written confirmation. This is a regulatory failure because dental boards often require clear, documented prescriptions for diagnostic imaging to ensure accountability and prevent miscommunication. Ethically, it bypasses a crucial verification step that protects the patient. Another incorrect approach is to assume the prescription is correct and immediately take the radiograph without considering patient factors like pregnancy or previous radiation exposure. This demonstrates a failure to adhere to radiation safety protocols, which are a cornerstone of radiographic practice and are strictly regulated. It also neglects the ethical duty to consider individual patient circumstances and minimize risk. A third incorrect approach is to question the dentist's judgment in front of the patient, implying incompetence. While verification is necessary, the manner of inquiry is critical. This approach is professionally inappropriate and can erode patient trust. Ethically, it violates the principle of collegiality and professional respect, even when seeking clarification. The correct approach involves discreet and professional communication with the dentist. Professional reasoning. Professionals should adopt a systematic approach to patient care, especially in procedures involving potential risks like radiation. This involves 1. Receiving and reviewing the prescription for clarity and completeness. 2. Verifying the clinical indication and patient-specific factors. 3. Communicating professionally with the prescribing dentist to clarify any ambiguities or concerns. 4. Adhering strictly to established protocols for radiation safety and image acquisition. 5. Documenting all steps taken. This structured decision-making process ensures patient safety, regulatory compliance, and ethical practice. Question 20. Cost-benefit analysis shows that implementing a structured four-handed dentistry approach significantly enhances practice efficiency and patient satisfaction. Considering the registered dental assistant's role in this collaborative model, which of the following best exemplifies the core principles of effective four-handed dentistry in practice, ensuring both optimal workflow and adherence to regulatory scope of practice? Option A. The RDA proactively organizes instruments and materials based on the anticipated sequence of the procedure, anticipates the dentist's needs by passing instruments smoothly and efficiently, and maintains a clear operating field, all while performing tasks within their authorized scope of practice as defined by state regulations. Option B. The RDA primarily waits for direct instructions from the dentist for each step of the procedure, only preparing instruments as they are explicitly requested, and focuses on patient comfort by engaging in conversation rather than actively assisting with the clinical workflow. Option C. The RDA focuses on preparing a wide array of instruments and materials at the beginning of the appointment, regardless of the specific procedure, and then passively observes the dentist, intervening only when directly asked to retrieve a specific item, leading to potential delays and a less streamlined process. Option D. The RDA attempts to perform advanced procedures or tasks that are outside of their legally defined scope of practice, believing that assisting the dentist in any capacity, regardless of regulation, is the highest priority for efficiency. The correct answer is A. The RDA proactively organizes instruments and materials based on the anticipated sequence of the procedure, anticipates the dentist's needs by passing instruments smoothly and efficiently, and maintains a clear operating field, all while performing tasks within their authorized scope of practice as defined by state regulations. Explanation: this scenario presents a professional challenge because it requires a registered dental assistant (RDA) to balance efficiency and patient care within the established principles of four-handed dentistry, while adhering to specific state regulations governing their scope of practice. The core of the challenge lies in optimizing the workflow to minimize chair time and patient discomfort without compromising the quality of care or violating any dental practice acts. Careful judgment is required to assess the patient's needs, the complexity of the procedure, and the dentist's preferences, all while ensuring the RDA is operating within their authorized duties. The correct approach represents best professional practice because it prioritizes a systematic and collaborative method that aligns with the foundational principles of four-handed dentistry. This involves anticipating the dentist's needs, preparing instruments and materials efficiently, and maintaining a clear field of operation. Such an approach directly supports the goal of reducing treatment time and enhancing patient comfort, which are key benefits of effective four-handed dentistry. Furthermore, it ensures that the RDA is performing tasks within their legally defined scope of practice, as outlined by the state's dental board regulations, thereby upholding ethical standards and patient safety. An incorrect approach that focuses solely on the dentist's immediate requests without proactive preparation or anticipation fails to leverage the full benefits of four-handed dentistry. This can lead to delays, increased patient anxiety, and potential burnout for both the dentist and the assistant. Ethically, it may also fall short of the standard of care expected in a well-managed dental practice. Another incorrect approach that involves performing tasks beyond the RDA's authorized scope of practice, even if requested by the dentist, constitutes a significant regulatory and ethical failure. This directly violates the state's Dental Practice Act, which defines the boundaries of professional conduct for RDAs. Such actions can result in disciplinary action against the RDA and the dentist, jeopardize patient safety, and undermine the integrity of the dental profession. A third incorrect approach that neglects proper instrument transfer or material preparation, leading to interruptions and a disorganized workflow, directly contradicts the core tenets of four-handed dentistry. This not only reduces efficiency, but can also increase the risk of contamination or errors, impacting patient care, and potentially leading to regulatory scrutiny for failure to adhere to established protocols. The professional decision-making process for similar situations should involve a continuous assessment of the procedure's demands, open communication with the dentist, and a thorough understanding of one's own scope of practice and the practice's established protocols. RDAs should proactively anticipate needs, organize their workspace and instruments logically, and always operate within legal and ethical boundaries, prioritizing patient well-being and efficient collaborative care.